Hi, this video is the RF hair transplant restoration surgery on an African American woman. This client, she actually had multiple procedure of scalp lowering, and scalp lowering is a more antiquated method where they cut out a piece of skin and suture you up and force it to go down lower. But unfortunately, it leaves you a linear scar. As you can see, hers is pretty wide scar and it comes up in a circle. Yeah, the scalp lowering is pretty effective in lowering that, but in terms of artistically and aesthetically, it won't look natural at all. And you cannot pull your hair back in a ponytail because the scar is gonna be revealed. And on top of it, it's a lot more invasive than the hair transplant. Nowadays, most people do hair transplant because even if you do scalp lowering and leave you a linear scar, guess what? You have to do a hair transplant on top of it to hide the scar. And so you rather do something less invasive, and then you can do it one time and then less scarring, and it'll probably going to give you the best effect. But again, hair transplant, especially with hairline, is very complicated. It's a lot intricate and there's a lot more depth and detail. It's not just doing a straight circle, and you can see that online, but then it doesn't look natural at all. There's a lot more depth, as I mentioned. So there's no hairline straight. There's quite a bit of zigzag, and there's a lot more depth into where the temple should begin. For men, temple pointed backward. For that's most acute backward for Caucasian men. African American men pointed this way, perpendicular. But for African American women, actually pointed forward. For most women, and then the zigzag is wider in width and higher in depth. Again, you have to go to someone who specializes in African American curly hair, who have a lot of experience, because if you don't, not only doing the harvesting part, doing the dissection part, doing the placing part, they can kill the graft, and the result will be poor density. And then of course not just poor density, but the hairline is where the artistry comes about. If you can turn and see, you see how the strip method, the scalp lowering, it leaves a liner scar, and it's very visible, and you still, the forehead doesn't look natural at all. And then not only that, but you have numbness permanent along the linear scar, more invasive, more painful, and then because of the cut off blood supply, you start thinning behind the hairline. And so that's not something that you want to do. And so we can still give her a forehead with 4 fingers, but she'll still want a high hairline, because she told me that naturally that's what she was born with, and she doesn't want to look something abnormal where you do it too low. And again, with my work, it's going to be natural. It's not going to be too high and too low. And hopefully she will come back for me to do a follow-up, because I know her look will change drastically. Okay? And this is the RF hair transplant. We're going to do around 3,000 grafts. And it's going to take around 12 hours. A full year for it to fully grow. Thank you.